On 29th of May, an ambulance was called at 9:30 a.m. At 9:45 a.m., the patient was brought to BSMP. 10 a.m. registration. 10:15 MXPAT surgeon. 10:45 finished DS. At 11 a.m., transferred to surgical department and start of medical treatment at 11:20 a.m. The surgery starts at 12 p.m.
Good morning, sir. Can I know what's your name and your age?
I'm Mark Sloan, I'm 30 years old.
Where do you live at and what do you work as?
I live at Lenina Street and I'm a carpenter.
Okay, what are your complaints today? How are you feeling?
I feel pain in the abdomen, at the right top of my abdomen.
Do you have anything else to add? Like, do you have vomiting or weakness?
No, but the intensity of the pain is low and it is reduced when I bend forward. I often feel weakness and fatigue when I stand up, and I always feel thirsty but I have no appetite.
Okay. Can you tell me what the color of your stool is?
My stool is in dark color and was repeated in watery form.
How long have you been feeling like this?
It lasted for many weeks.
Did you take any medication when you were feeling that way?
I took anti-inflammatory whenever I feel dizzy or weak.
Patient complained of pain at his stomach area, but he has no other symptoms to determine the exact disease yet. Based on the data that we have collected, we could predict that it is due to dehydration, probably because of hemorrhage in the gastrointestinal tract.
Do you take alcohol often?
Yes, but I drink 1 bottle in a week.
Okay, are you married?
No.
Okay. Do you have history of diabetes mellitus, TB, stroke, myocardial infarction?
No.
Okay. And also, have you been involved in any operations before this?
No.
Did you have any history of duodenal ulcer previously?
Yes, for the past 5 years.
Okay. And what medication did you take for it? Did you take any?
I took ibuprofen for 2 days.
Okay.
Upon general inspection, we could see that the patient scores 15 on the Glasgow Coma scale, meaning the patient could spontaneously open and close his eyes. Verbal response are oriented to time, person and place, and also motor response could obey to command. The skin looks pale and clammy, while the mucous membrane looks dry. Both of these are indicators of dehydration.
Now I'm gonna check for your vital signs, and let me examine you. Okay. So let me check your blood pressure and your pulse and your respiration rate. So let me go with the blood pressure. Keep your hands straight. Okay.
How is it?
Blood pressure is 100/60.
Is it normal, right?
No, it's not normal. You have hypertension, so I can just conclude that for now.
Pressure of 100/60, showing that he has hypotension.
Okay. Your respiration rate looks abnormal. You have tachypnea and tachycardia.
During cardiovascular system inspection, we found out that the patient's pulse rate is 120, meaning he has tachycardia.
Upon inspection of the respiratory system, we could say that the patient is in pain and he's having tachypnea. Tachypnea is an indicator of fluid deficiency, which could be caused by hemorrhage.
Both of these are indicators of fluid deficiency.
Okay, so we need to do furthermore diagnosis tests to conclude what problem is in you. So can you go and wait at the room over there? Do you feel pain over here?
Yeah, slight.
Okay. Here?
No, yeah, slightly. Okay.
Here also?
Yes, yes.
Okay. Do you feel pain over here?
No,
No.
no,
Here no. Here?
no,
Here also no.
no.
Okay. So your pain is over here.
Yes, yes.
And here also.
Here, yes.
Where is the pain very intense?
Bit
Here or
lower.
here?
Yeah, in the center. Bit
Here.
lower, yes.
The pain is intense over
Yes,
here.
yes.
Alright. Okay. Here, right?
Yeah, correct.
Alright. Okay. Okay. After the inspection, we can see that you have dehydration, and we suspect you have internal bleeding. So that causes the pain in your stomach region. So we need to do one more test. We need to examine your stool. So can you give us a sample of your stool in this bottle?
Yeah, sure.
Okay, thank you. Okay, now we have the stool sample of Mr. Mark, and now we are going to examine the stool. Now we can observe that the stool is very dark and it has blood in it. This may be due to the internal bleeding of the GIT. Good evening, are you the relative of Mr. Mark?
Yes.
Okay, our patient Mr. Mark have upper internal bleeding in the GIT suspected at the duodenum part. Our patient has been observed that he is dehydrated and his vital signs are changed. He has tachypnea, tachycardia and hypertension. And mechanism of fluid loss is on intravascular fluid compartment due to blood loss. And he has deficit of the circulating volume. He has minimum of 1.5 liter of blood loss, which is a class 2 bleeding. And our patient has also consumed ibuprofen, which made the irritation on the GIT, which increased the chances of bleeding. After the inspection and examination of the report, this is the finding of Mr. Mark. Do you have any questions?
Intense.
Alright, thank you.
So I will have to perform one more surgery on your stomach, that is stomach lavage, and for that purpose I have to insert in a nasogastric tube and I have to take off all the fluid which is inside. So are you ready? Can I do it?
Yes.
Okay. Let's go for the surgery.
The nasogastric tube is inserted into the patient till the level of stomach. Then before irrigation, we need to aspirate the stomach and clean if any contact present. Insert the syringe in the tube and pull the plunger arrow from the body till the time nothing comes through the stomach. Then take out the syringe and discard it. Remove the plunger of the syringe and clamp the tube. Then add normal saline solution, 50 ml per kg body weight at a time. For example, if a person's weight is 60 kg, you have to add 900 ml of saline solution at a time. The position of the patient should be left lateral. After sufficient water is poured in the stomach, separate the tube from the syringe and put away from the patient's body in downward direction.
Are you feeling comfortable after lavage?
Yes.
Okay, so now it's time to do your main surgery, that is endoscopy, for detecting that you have ulcer or not.
Flexible tube down to your throat into your esophagus to your stomach. It will take 20 to 30 minutes to complete. A tiny camera is inserted, and when the procedure is over, the doctor will generally remove the endoscopy. Duodenal ulcer is a sore that forms in the lining of duodenum. The main cause of this damage is with infection with bacteria called Helicobacter pylori. Food and beverages should be avoided like coffee, chocolate, spicy food, alcohol, acidic food like citrus, tomatoes, and caffeine.
Hello Marcelone, I am Dr. Mira. I am going to be your doctor for your treatment process. Okay, after getting the result from the lab and also you are having the instrumental diagnosis just now, together with your complaints, also subjective and objective examinations, we can conclude that you are being diagnosed with duodenal ulcer, which lead to internal bleeding class 2 at the upper part of gastrointestinal tract. So the goal of the treatment is to stop the bleeding.
The goal of treatment for a patient with duodenal ulcer is to stop bleeding and to locate and stop the source of bleeding through surgery and physical, chemical, and biological methods of hemostasis.
Right now, I am going to explain about the plan of your treatment, about what you are going to do during the treatment. Is that okay for you? Okay, first of all, you will have to be in this position. This is called supine position all the time to stop the bleeding. You also will have the NPO diet, which means you cannot have food or drink using your mouth. You also cannot do any physical exercise because this may cause your bleeding to become more worse. We will provide you such medications to speed up the process of your recovery, such as we are going to administer fresh frozen plasma, vitamin K, vitamin C, and also intravenously injection of calcium chloride, 10% 10 ml, and also aminocapuric acid. Is there anything that you may ask me regarding your treatment plan?
No.
Everything is clear for you?
Yeah.
Don't worry, you are in a good hand. You will be monitored from time to time.
Okay. Thank you, doctor.
You are welcome.
An ice pack is placed on the right hypochondriac region to relieve pain and also to promote vasoconstriction of vessels to stop bleeding. The patient can also chew and swallow on ice to produce a vasoconstrictor effect on the blood vessels of the GIT. These are chemical methods to produce hemostasis. FFP is administered for management and prevention of bleeding prior to an urgent invasive procedure. Angioprotectors such as vitamin C reduce capillary fragility and permeability and prevent basal endothelium damage of blood vessels. Vitamin K is used to treat and prevent low levels of blood clotting factors in the body, which is used to stop bleeding. Introduction of calcium ions play a major role in tight regulation of coagulation cascade that is paramount in the maintenance of hemostasis. Antifibrinolytic agents are medicines that promote blood clotting by preventing or slowing down of a process called fibrinolysis. They are used in surgical procedures to prevent excessive blood loss.